We're here, Eric, if you're doing a roll call.
Yeah, hey guys.
Just for this.
Sioux Falls is here.
Hey guys. Welcome everyone, and thanks for thanks for participating in the No Wrong Door training that we have for you today. First of all, I'd like to check and make sure that all the sites are up and running. I think I'm looking at Brookings there. Is that you, Bernie?
No, it's not.
Oh, where are you at?
Yeah, I'm in Brookings.
Okay. All right, I thought so. How about Aberdeen DHS? You guys on?
Yeah.
Yes, we are.
Yep.
Yes, we're here.
All right, thank you. Let's see, the Huron site. Carmen, are you with us today?
I am.
All right. Rapid City Department of Human Services. Are you guys on with us today?
Yes, we are.
Nice. Okay. Sioux Falls DHS. Are you there?
Yes, we're here.
We're here, Eric.
Good. Do we also have the rehab? Do we also have the rehab center?
I apologize. We are the rehab center.
Oh, okay. All right. Then do we have the district office as well? Did I hear the district office, Sioux Falls district office as well?
Yes, you did.
All right, good. And then Watertown DHS, are you guys on?
They may have
Check
had all
on-
their staff attend yesterday, so I don't know if...
That's what I'm guessing. We'll double check just to make sure. And then Yankton DHS, are you guys on?
Yes, we have 4 smiling faces for you in Yankton.
All right, great. Becky, can you just call Watertown and make sure that that it's working? I'd rather you do it from. Thank you,
I tell you what, Eric, I can call them while you start.
Becky.
I can call them while you start.
Yeah, okay, that's fine. Just to make sure. A couple things before we get started. First of all, please remember to mute your DDN site unless you are speaking. At any time during the presentation, today's presentation, if you have questions, feel free to stop me and ask. I also want to test to see that that people are seeing the PowerPoint that you'll be using today. If I'm going to click a button here in a second, and if you see it in some of those sites out there, just let me know. It should be coming up here momentarily. Are you seeing the video?
We see it in Rapid City.
Good.
We see it in Sioux Falls.
All right, appreciate it. Thank you. With the invitation to this training, you should have received a sign-up sheet. Hopefully, someone printed off a sign-up sheet in your site. Please pass that around, and then return it to either scan it and email it to Janet Ball, or you can mail it to Janet Ball. Once it's signed by everyone in attendance in your site. This is the second session of the training. Yesterday's session was identical to this one. If there is someone that's unable to attend, they can contact their supervisor and coordinate a way to obtain the training. The training today is being recorded, so once we get that audio and visual, that recording of this session, we'll be able to put that on the DHS intranet as well, for training purposes, for new staff especially. All right, I'm going to switch over to the DDN now. Or, I'm sorry, to the PowerPoint. So, to start off with, what is what is the No Wrong Door initiative? What are we really talking about? What does that exactly mean? For years, it's been on the Department of Human Services website, and it's been listed as a guiding principle for the Department of Human Services. And in fact, today it remains on the Department of Human Services website. It's part of our strategic plan. It's an objective in our DHS strategic plan. The goal of the initiative and the training today is to strengthen DHS employees' ability to effectively assist the public. Again, what exactly are we talking about when we talk about no wrong door? You might have heard the phrase before. It's also been referred to in other government agencies, both in the state and in other states. What we really wanted to do in DHS is further define what it means, what the phrase "no wrong door" means, and really assist the staff in helping to provide good customer service. Really, what we try to do is operationalize the concept, not just talk about no wrong door, but actually give you the ability to provide a good level of customer service. Let's see. Our intent today is to assist you in helping anyone who contacts the department and by utilizing the no wrong door approach. What we're talking about is customer service, really. This might include taking extra time to talk with someone about their life situation. It might mean explaining the various services that are available in the Department of Human Services and how to apply for them. It could also include offering to assist people with contact information for another service or another service agency. Our goal is really to assist each individual who contacts the Department of Human Services by providing guidance and information. And I think one of the ways that you can do this, we're not expecting everyone to have, compendium of information right at their fingertips. If you are speaking with someone from the public and don't know the answer to their question, it's recommended that you get the caller's information and refer them to someone who can assist them. And it also might mean, calling them back yourself with contact information to another service agency. Now, I mentioned designing something to help you provide customer service. What we did is, as a work group, we identified the need to put together a resource directory for DHS staff. And what we decided was that we could do this fairly easily just by identifying those other resources that are already out there. So the directory that we developed can be found on the DHS homepage, and it's on the DHS intranet as well. And you may have noticed it's also found on your computer desktop, and it should appear as an icon entitled "No Wrong Door." Now, it's funny actually that the icon right now on your desktop doesn't work very well. And I'll explain that a little bit later. But for right now, it's if you clicked on that icon on your desktop, it wouldn't bring up the online resource directory. But that's in the process of getting repaired. The online resource directory provides a single point of entry to assist in linking an individual to resources. And like I said, what we discovered was that there was a number of valuable resource directories already out there. We simply wanted to compile them all and put them in one place for easy access. And the directory consists of a variety of existing resources, links to existing resources, and then a brief description for each. Bernie, you want to take it from here?
Yep. Can you hear me okay?
Yep.
Okay. Thanks, Eric, and good afternoon, everyone. Yeah, I just checked that link on the page, and you're right, it doesn't work. It was working at one time, but if you go to the Department of Human Services website and you click on the No Wrong Door, it's going to bring up a list of directories that have a lot of good resource information that individuals with disabilities may need or could benefit from. And the reason we're doing this initiative is we do get a lot of calls for various issues that or crises that people may have in their life, and we need to look beyond our own current program and services and simply say, no, we don't do that and hang up. It is trying to help individuals and providing customer services to help them find the resources and to get them pointed in the right direction. So when you open up the No Wrong Door list, you're going to get about 10 or so different directories we identified that provide really good information or ways to find information. And it was not our intent to reinvent the wheel and recreate a very comprehensive directory out there, because we felt there were a number already in place that we can just help utilize better. And the first one is the South Dakota homepage. And Eric, if you would go to that. And so when you click on that link, or you simply go to the South Dakota homepage, you can just a very good search engine is right there in the beginning. I mean, in the middle, when they did upgrade the South Dakota homepage, a lot of people didn't like that lower bottom and the top. You couldn't see a lot, but it does have a very good search engine in there that if you would type a word like disability or autism or learning disability and you press enter, it's going to bring up a lot of good resources, programs on that topic that are South Dakota, and it searches pretty specifically into South Dakota. So yeah, it found the South Dakota Department of Human Services, short-term disability, a lot of good different resources that you can click on to seek further information. And of course, the more specific you get on your topic, then the better type of information. So that's a very good resource out there when you're looking for South Dakota information. Now, while you have the South Dakota homepage up, I want you to go to the bottom left corner of Open Government. And there you're going to find the phone book. I'm waiting for the screen to change. You could click on the link that was in that PowerPoint, or you can simply, I always go, and sometimes I make this a shortcut on my desktop too, because I go a lot of times, I'm trying to find the phone number for someone in Office of Special Education or Department of Labor. And so like Melissa Flor, I always look for, so if you just type in FLORR, I think it's just that one, and just a search, it'll bring up her phone number. Plus all the floors that are, so you see Melissa is with Department of Education, her phone number there, that may not be her direct number. A lot of times that is their direct number. And sometimes it may be their office number. It depends on how they have that set up into there and what their fax may be. And then if you click on her name, you get the address too. So a lot of times that you're trying, the person, their name, but you don't know their phone number. And the reason this is important, if you do get a call, you know where they should be transferred, what we do want is for good customer service that you give the individual the phone number, but say, let me transfer you now. And you'll see that happen a lot of times in businesses. They give that phone number to you in case you get disconnected. And that's just good customer service. And do realize that, if people have crises or issues in their lives, part of their frustration is because of the needed service they have, but also a lot of frustration is the how they were treated in the process. And that's why it's important for staff to realize that we need to be able to provide a good customer service onto there. I haven't explored this. This site has much more opportunities and abilities, like you can click on conference rooms or city government or public schools. And, you can find out, go to public schools, for example. And I think I was dealing with Harrisburg today, and I think it'll give you their phone number and stuff like that. So, and I could have simply click on Harrisburg. I think it was one I was dealing with today. It needed the phone number, and I probably could have simply just gone to the site and got it instead of emailing the counselor back and forth and trying. So it's a good resource of trying to get information. Phone numbers of people and stuff like that. I don't know, even have maps. I never looked quite at that map situation, but it does have a lot of good information here on this site that probably we should look at and explore more onto there. If you go back to the PowerPoint, Eric. And the third resource we had there was our Department of Human Services itself. I mean, our department has a lot of different programs. Even within the Division of Rehab Services, we have deaf services, we have activities daily living service. So it has a lot of different programs, but this has the programs and contacts within our department, from the guardianship program to who our fiscal people are, and so on into there, and kind of a description of their program. So go down a little bit to like Division of Rehab Services or something, or one of the other divisions if you could. Independent living services, the program, and so it gives you information onto there, and sometimes it may give you the specific contact people. So, or to their websites are good information and resource. So the department itself has a directory of the programs we do provide into there. So if you'll go back to the PowerPoint again. And when you go back to PowerPoint, the other directory I'd like to show you is the Center for Disabilities. And the Center for Disabilities is not a web-based one. I think it links you to a print manual they did some time back, and I'm not sure how often they do update this. And this directory is pretty specific to disabilities, and they talk about some of the resources there, from advocacy to child services to employment and so on. But go ahead and open that up to show some of the resources into there. And this is a 90-page document that's available, and so you can see the different disability programs and try to get more information on them more specifically. It's a pretty good resource that way. So, and then the last one on this screen I want to show you is from the Department of Social Services, a resource directory. And this one is pretty nice that it does break the information down into a county type situation. So when you click on that, let's just look for Hughes County, for example. Wait for the screen to refresh here. This gives a lot of good information on phone numbers, even from an emergency phone number. So this may not be a bad document to print and even have hanging on your wall by your office for your specific county onto there. You may not deal with all of them, such as the chore services when rent a kid, but you may be dealing with the different government agencies involved in their different healthcare programs, different housing programs that they may have, information and referral programs from adult service aging to the peer area referral, legal services, nutrition, transportation programs, ARP and such. I mean, there's quite a bit different programs that are available on it, even as Western Resources for Independent Living is even listed on the other section onto there. So, again, this is probably a pretty good document to have by your desk for the areas that you're serving onto there, and it provides some specific phone numbers for you. And again, when you are assisting individuals, if they are contacting through email, you can just send them the link to the resource directory, or such if they call you, that you can give them the phone number but just transfer the call. But that kind of covers the resources on those 5 on that page. And Eric, you're going to go through the last 4.
Yes, I will. While I'm getting there, there was a good question from the peer site. Asked basically, is this available to the public? And I would say absolutely, it's available. It's on our DHS homepage. And I would share it with whoever you want to, providers, individuals, public. Make sure it gets used out there. Use it. Share it with whoever you'd like to. As we continue with the resource directory here, I want to take you to another Department of Social Services site. And this just has a list of key services along the side. And I think the Department of Social Services does a pretty good job of giving information on each of the services that they offer. And you can see I clicked on child care services here, and it gives a description of the services that are available, and then it also gives a lot of additional links that are associated with child care services along the right-hand side of the page. So another useful website from the Department of Social Services that you can use to help connect some of your people or the public with resources. The 211 helpline is a number that people can dial for free 24 hours a day to learn about nonprofit and government services. And they can also use the website that I'm pulling up to search and learn about different resources that might be available to them. If the person calls, the 211 specialist will be available to offer support and connect people to the resources that are needed. If a person calls, that phone number will help with people who live in the Sioux Empire areas, the Rapid City areas, Sturgis, and the Hills region. But as we learned at the training yesterday that the resources on the website, on the 211 website, might in fact be statewide. So another useful website here. The next one I'm going to take you to is the Parent Connection Family Resource Guide. And this resource guide provides information on local, state, and national resources that are available to meet the needs of families raising children and youth with disabilities. You can from this page, the best way I think to navigate or to start your initial navigation anyways is to go to the right-hand side of the page under the resource guide and choose one of these 5 links here. So the main categories under the resource guide are health and wellness, paying for needed services, children and youth, family advocacy and support, and transition to adulthood. And finally, we have disability.gov, and I'll navigate to this site for you too. Disability.gov is a federal government website for comprehensive information on disability programs and services in communities nationwide. You can see there's a topic list on the left-hand side of the page, and then there's also a search capability towards the top of the page. So you can use either one of those methods to navigate this website. There's of course, as you might imagine, there's a ton of information on disability.gov. Anything from Social Security benefits to employment to affordable housing, really a wide variety of information on disability.gov. Any questions before we continue?
This is Randy in Yankton. Fairly frequently we receive contacts from people looking for vans that are already equipped to be wheelchair accessible and usable, or vans that can be adapted for drivers that use wheelchairs. I see that Steve is there. What might be the best resource to pass on to those folks?
I've looked some on that 211 helpline and found some things on there, but I've always told them to, depending on who they are, but you could check with the van modification organizations and ask them about used vans that people have got for sale when they upgrade or get a new one. And there's the IMED NT and R&R conversions, Blackhawk van conversions. And there's some other ones, out-of-state ones, that might have, vans available too. I've never really got a good follow-up from anybody on how it worked, but I know I've seen some that they have available. But it's real hard to match up with the individual's needs too. They're pretty custom, so you might find one, but it really wouldn't be what you wanted or might be out of your price range.
Okay,
Yeah,
thanks.
This is Bernie. I think a lot depends if they're a VR consumer or if they're current VR consumer. We can help them with that and consult with Steve. Or if they're just someone that that won't meet financial need and wants it for their elderly parent or something like that. I mean, we can help them. If you're in the Yankton, Sioux Falls area, I think that place by T does have some used vehicles with with lifts in and stuff like that. So
I've always encouraged for our consumers, it is kind of a good idea sometimes for them to look for a van that's already modified, because then they have to still pay for the van, but we can pay for the modification. But we've got to make sure match that up, and they're not getting a modified van that's got way more modifications than they actually need. But
okay. And I think when we get into this more, this is Bernie, it's, we're dealing a lot with day-to-day stuff with our clients, and there's a lot of good resources that are coming through this material we shared, but a lot of this is also people who are not our VR client, that they call in and they ask for information about vans, and the person answering the phone said, well, no, we can't do that, and just hangs up. It is a matter of the customer service and how we deal with these individuals and how we can provide some information back to them. And so that's what the No Wrong Door initiative is really about, is the customer service that we provide to the general public and to our consumers on the questions or needs that they may have. And again, like I said before, in many situations, people are just as upset in how they've been treated through the process or the timeliness of being responded to as the lack of not getting services, because there's many times they may say, this is the fifth person I've been told to call, or I called these people and they haven't returned my call. And when we deal a lot with governors' requests. People are calling the governor's office, and it's not that we're going to be able to meet all of everyone's needs. But, the things that really stick out sometimes is the customer service. If they say that I've called this office and they never called me back, those are things that we really want to follow up and try to improve upon if we all possibly can onto there. So when you get a phone call, if you don't know the immediate answer, simply say that, I need to look that up a little bit or talk to someone, and can I get back to you by the end of the day with hopefully a response or tomorrow morning. Give them a date and time that you'll get back to them. I'm sure most of them you're getting out there are through phone calls, but we do receive emails, a lot, inquiries. Also, if you ever went to, I think, most of the state agencies' websites, you'll see a contact me. If you go to the Department of Human Services, you'll have an icon or a tab that'll say contact for information, or even our Division of Rehab Services. And then when you click on that, and then you kind of put your name and your email and what you're kind of asking, that does get forward to the different divisions. And I know in Rehab Services, we pretty well handle those within a day. Some of those are coming out of state, but a lot of are coming in state. And some people are saying that, I am on disability. I do want to help get back in employment. It is a matter of giving them either the website to where they can put in their county, or I send them our brochure sometime, tell them to call the office that's closest in their location. Or if they do say where they're from, we'll give them the 800 phone number for their office location. So again, a lot of it comes back down to the customer service that we do provide for people. And I'm going to give a couple examples of where people call in, and it doesn't have a lot to do with voc rehab sometimes, and it's real easy to say, I'm sorry, we don't do it, and disconnect. But example I had is someone called for, wanted to help establish a support group for a specific disability in a community. Employment wasn't part of that into there. But what I did do is give them the phone number to the independent living center that was in that area, because they had been dealing with these individuals and also some peer support, and they knew about that. And so, that was a way to help them, because we do have a lot of other programs within our own division and even beyond the voc rehab. And it's giving them information, helping them connect onto there. We do get some requests from people who are out of state at times, and I had a call from someone on Florida, a student on a disability situation, and they were talking about advocacy services. I referred them to contact their state VR agency, or to help on their dispute in this situation. And an easy way to find that is you just Google Colorado voc rehab or Florida voc rehab, and it'll take you to them. Or if you look at how our state web address is state.sd.us, to simply change that SD to CO, and you're going to get to Colorado's department government homepage and stuff. So you can help them get that information and a phone number pretty easily onto there. We do get the website requests probably I'd say a couple times a week. I'd say rehab services. I think on the average we're probably getting some type of requests every day, one form or fashion. So we do get them a lot at the state office onto there. I guess we want to take this time here and talk about the requests that you may be getting. And I think, Nadine, you even had one, didn't you, on someone from the college that was, the disability coordinator contacted you for an ADA kind of a question? Yep. And you sent us an email, and I think Steve Stewart had some resources on to there. But what are some of the types of requests that you folks may be getting out there in different offices? Randy, you talked about the vans. Do you have other requests that may be coming through?
Not at the moment, Bernie.
Okay, I do want to mention something that Yankton said they were getting. The staff from Yankton said they were getting the other day was people walking in their office thinking they're going to the Human Service Center, and your staff said you even have a map for them how to get there. And that's, again, what the no wrong door is to customer service. And we're not asking you to drive them over there, but you're giving them a map how to get there. Those are the kind of, information and sharing and stuff.
Yes, we do have a map that we distribute, and it seems to work pretty well.
Okay. How about Sioux Falls? Are you getting certain types of calls or requests that come in?
This is Today, someone asked for a list of apartments because they had just moved to Sioux Falls. And I said you could just Google an apartment complex or properties like Lloyd Properties, but then I referred the call to the walk-in call. I didn't know. Okay.
Another thing is, too, is they have a disability situation that, the phone number to the Independent Living Center would be a good resource out there, especially if they need accessible apartments. And they would be a good resource onto there. So, okay. How about Aberdeen? Aberdeen?
Yeah, we're trying to think of the most common one that we get, but we haven't come up with any good ideas.
I get a lot of referrals for like housing and energy and system.
Yeah.
Yeah, that's a good one.
Yeah. Okay. And I think going to the state homepage and typing housing assistance may be a way, or that social services one may have some assistance on there too, that directory onto there. And I know you guys said the other day, your other staff said that the insurance agency that used to be in there, you still get people walking in there looking for that. So
yes, and the
farm service agency.
Yeah, the farm service agency too, that USDA, whatever.
That's right.
So okay, Carmen, how about you?
We get a lot of people that are homeless and need a place to stay for the night. I did have one employer contact me. Their person was getting their walls banged up from their scooter and wanted to know if there was something that could be done for that. And Steve Stewart gave me some information on tax breaks or tax credits for that employer that I passed along. I get calls about schools not cooperating with their IEPs. And get a lot of housing assistance, food stamps, heating assistance. And one time I got a call from a lady in New York who watched this drug addiction rehab reality show and said that my number came up after that TV program as a person to call to help that person in New York get rehab services for drugs and alcohol.
You get the 1-800 hotline, huh?
I guess I did, but I just gave her the whatever drugs and alcohol number in New York, or the whatever it was, social services or whatever.
Okay.
So I Googled it.
Rapid City?
Well, I had a lady come in the other day who was having some problems. It was obviously a workers' compensation issue and required, I thought probably required an attorney. And I listened to her quite a while and tried to brainstorm what she could do. I finally determined that she should probably find an attorney, but then I told her that if she gets that stuff resolved, she could come back here and apply. And mostly, though, we get calls about housing and food stamps and transportation, in general, that's the kind of stuff we get.
And walk-ins.
Okay. Okay. I would have to say the most interesting one I had was someone who said they're from Florida calling, and they said they were the mother of a child with disability, and they're complaining about their VR counselor in Florida, and they would not send their child to college or something like that. And I looked up on the internet the Florida State Office VR, even their advocacy program. I gave her that information, and I finally got her phone, and then about a month later, I got the same call, but this time she was the aunt. And you could tell it's the same voice. And it says, ma'am, I talked to you a month ago. And here again are these numbers. So it just, we do get a lot of calls. People are just Googling vocation rehabilitation, and 56 of them come up, or how many are for each of the states. So we do get a lot. So I don't know if there's any other office wants to give an example. Otherwise, we'll kind of move on. And again, too, it's also a good strategy to just simply say, let me look into this if you don't have the immediate answer, or like what Dawn said, she transferred it to the person that was on call that day and stuff. So if you want to go to the next slide there, Eric. Be number 9. A while back, you may have seen the No Wrong Door icon show up in your desktop. I believe it was working there. They'll be working on fixing that and getting it correct. So when you do get a call that's on your desktop, just click on that, and that'll take you to those 9 or 10 resource directories that we kind of went through onto there. Also, again, it's on the department homepage. And again, feel free to share this document with providers or publics, or if you have the email, share that email with them. Or if it's, so how you want to share it, feel free to do that. The expectation, again, is we may not have the answers for everyone's needs. Or crisis or situation that may be appearing to them. But we do want to help people the best we can and be able to help them with good customer service. And especially, South Dakota does have a lot of different programs and resources available. And we want to help try to connect people to those as much as we can. And we need to think about more than just beyond our current office, our current program, and our current services, because we do have a lot there. And then in conclusion, I guess I want to see what comments or questions that people may have out there on the No Door initiative. And again, I remind you that we do want all the staff to go through this training. And if they're new staff, we do want them to view this video and understand the No Wrong Door initiative. It is part of the new employee training. So if people were not available to see it, we do want them to view this through the video file that's going to become available. But I want to take some time. We have like 15 minutes left to what questions and answers that you may have. Don't everyone speak at once now.
Bernie, this is Carmen in Huron. We get a lot of requests for people who are homeless and need a place for the night. And we have a couple of resources that we can utilize, but sometimes they just don't work out. So I guess I'm looking for then, do we just tell them, like go to Walmart, it's open 24 hours, at least you'll be warm, or...
Well, let me ask this, Carmen. They don't work out. I mean, these homeless shelters do have requirements such as sober.
Well, we don't have a homeless shelter.
Okay, well, some of those places I know in Rapid City will have those requirements, and yeah, I mean they're available to help people, but they're going to have to meet those requirements. And again, we're not going to be able to meet everyone's needs on these situations. But you said there were a couple programs that were available in Huron that I give them that information. I mean, if they're a person with a disability, we may be able to help them in some immediate needs on some, if they want to start working. Otherwise, I would also connect them with an independent living center, but I know that's not going to meet their immediate need for that night for a place to live and stuff unless there is a facility in that community.
Yeah, this is Steve in Pierre, and I just had a comment that I can remember, this has been around for a long time, and I kind of forgot about some of the resources that we just went through, and I know they're all good ones, so something to remember and refresh yourself on from time to time.
Mm-hmm. And again, like I said, I'm going to use the homeless one, for example. I know Sioux Falls has got a homeless VA program initiative starting, but I know the ones in the Sioux Falls and Rapid City, they are the shelters there with the food and stuff, but, the people got to come sober. My understanding, they will not take them if they're intoxicated. And, I mean, those are going to be those requirements. And if they're looking for a place to stay while they can be intoxicated, there may not be. But we can give them information with the homeless shelters or those facilities or independent living centers and stuff. You guys have good questions or any other ones you may have? Anything? Okay. Well, it's the system cuts off right at 5 o'clock, and we're within like 10 minutes or so. Thank you guys for taking the time to sit in a presentation today. And again, this is a very important initiative for the department, and all the divisions are implementing the training for their staff in this form or fashion. And this is how Rehab Services and SBVI have chosen how to do this. And again, we're making it a part of our new employee training and training the existing staff we have. So I want to thank Gay and Eric for helping put this together also onto there. So I don't know if you guys have any other questions. We're pretty well concluded for today. Other than that, you guys have a good day.
See everyone.